Part A. Extract 1. Questions 1 to 12. You hear an immunologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Kane Major, an immunologist. I understand you're here today because you're experiencing some outdoor allergy symptoms. Could you tell me a bit more about what's been going on?
Good morning, Dr. Major. Yes, that's correct. I've been having some really troubling symptoms lately. It's mainly when I'm outside, especially when I'm gardening or even just walking on the lawn. I start feeling itchy all over, and my skin gets red and blotchy. It's gotten so bad that I've had to stop gardening altogether, which I really love doing.
That sounds quite uncomfortable. Could you describe the appearance of the rash in more detail? Does it appear immediately when you're outside, or does it take some time to develop?
It usually starts about 10 to 15 minutes after I'm outside. The skin on my arms and legs becomes red and swollen, and I get these small, raised bumps that are really itchy. The rash sometimes spreads to my face if I stay outside for too long.
I see. And how long have you been experiencing these symptoms?
It started about 6 months ago. At first, I thought it was just a minor irritation, but it's been progressively worsening. I've tried over-the-counter antihistamines, but they only provide temporary relief. The rash comes back as soon as I step outside again.
Have you noticed any other symptoms, such as difficulty breathing, wheezing, or swelling in other areas, like your lips or eyes?
Not really, no difficulty breathing or anything like that. It's mostly just the rash and itching, though sometimes my eyes get watery and scratchy.
Thank you for the details. Let's talk a bit about your medical history. Do you or anyone in your family have a history of allergies, asthma, or any other related conditions?
My mother has asthma, but she never really had skin problems like mine. I've had hay fever in the past, but it was mostly mild. No one else in my family has severe allergies, as far as I know.
What about your social habits? Do you smoke, or are you exposed to secondhand smoke? Do you have any pets at home?
I don't smoke, and we don't have any pets. I'm usually quite healthy, so this has been really frustrating for me.
I can understand that. Let's move on to a physical examination. I'm going to take a closer look at your skin. I can see some residual redness on your arms. Does the rash typically appear this way, or is it worse?
This is actually better than usual. The bumps have gone down a bit since I haven't been outside today. On bad days, it's much redder and more swollen.
Alright, thank you. Based on what you've described and what I'm seeing, it's likely that you're dealing with a type of contact dermatitis, which is an allergic reaction to something you're coming into touch with outdoors. This could be due to pollen, grass, or possibly certain plants in your garden.
Oh, I see. Is there anything I can do to treat it or prevent it from getting worse?
Yes, there are several steps we can take, Mihiraa. First, I'll prescribe fexofenadine, a stronger antihistamine to help control the itching and inflammation.
That will be very helpful, doctor.
I'll also give you a topical corticosteroid cream to apply to the affected areas when you notice a flare-up. In addition to medication, I'd recommend wearing long sleeves and gloves when you're outside to reduce skin exposure. It may also help to shower immediately after being outdoors to wash off any potential allergens.
That sounds manageable. Should I avoid going outside altogether?
You don't need to avoid the outdoors completely, but it's important to minimize exposure to potential triggers. If the symptoms persist or worsen despite these measures, we might need to do some allergy testing to pinpoint the exact cause. We'll schedule a follow-up appointment in about 2 weeks to see how you're responding to the treatment, and we can discuss further testing if necessary.
Thank you, Dr. Major.
Extract 2. Questions 13 to 24. You hear a gastroenterologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Dr. Gary Stock, the gastroenterologist. I understand you've been having some difficulties with your digestion. Can you tell me what's been going on?
Good afternoon, Dr. Stock. Yes, it's been pretty bad lately. For the past 2 weeks, I've been vomiting almost everything I eat. It doesn't seem to matter what I eat, whether it's a full meal or something light. I feel nauseous, and then within an hour or so, I'm throwing up.
That sounds very distressing. How are you feeling right now? Are you still experiencing the vomiting, or have things improved at all?
I still feel nauseous, and I've actually been avoiding food because I'm scared of vomiting again. I've tried sipping on ginger tea, but I'm constantly tired and weak because I'm barely eating anything. I've taken over-the-counter antacids like Gaviscon, but nothing seems to help.
I can imagine that must be exhausting. When exactly did all this start? Was it sudden, or did it build up over time?
It started about 2 weeks ago. At first, I thought it might be food poisoning because I felt queasy after a meal, but then the vomiting continued. I tried resting and eating bland foods, but it hasn't improved at all. I don't have any diarrhea or fever, just this constant nausea and vomiting.
All right. Let's go over your medical history. Have you had any previous issues with your digestive system or any other health concerns we should be aware of?
I've had some issues in the past, but nothing like this. A few years ago, I was diagnosed with gastritis, and my doctor prescribed omeprazole, which helped with the acid reflux I was experiencing at the time. Other than that, I've had the occasional bout of indigestion, but it was manageable. I'm not on any regular medication now, though.
Thank you for that information. Have you noticed any other symptoms besides the vomiting and nausea? For example, any abdominal pain, bloating, or weight loss?
I've lost some weight, about 3 kilograms in the past couple of weeks, but I think that's because I've been eating so little. I don't have much pain, just a dull discomfort in my upper abdomen, and the bloating has been mild.
I see. Let's proceed with a quick physical examination. I'm going to press gently on your abdomen to check for any tenderness. Let me know if you feel any pain. Any pain here?
A little, but it's more of a discomfort than sharp pain, especially in the upper part, just below the ribs.
All right, thank you. Based on what you've told me and the examination, it seems likely that your vomiting may be related to a condition called gastroparesis, which means your stomach is not emptying properly. It's possible that the muscles in your stomach aren't functioning as they should, which could explain why you're vomiting after eating.
I've never heard of that before. What causes it?
It can have several causes. Sometimes, it's related to nerve damage, especially in patients with diabetes, but it can also happen after a viral infection or in connection with other digestive conditions like gastritis. In some cases, the exact cause remains unclear, but it's treatable.
That makes sense. What can I do in the meantime to stop the vomiting?
For now, I'm going to prescribe a medication called metoclopramide. It helps to stimulate stomach muscle contractions and can reduce nausea and vomiting. We'll start you on a low dose and see how you respond. It's important to take this before meals to help with digestion.
Okay. Will that help me start eating normally again?
Hopefully, it will ease your symptoms enough for you to begin eating small, frequent meals without discomfort. However, I'd also recommend we run a few tests to confirm the diagnosis. We'll arrange a gastric emptying study to see how well your stomach is functioning. I might also suggest an upper endoscopy to rule out any structural problems like blockages or ulcers. I'm sure we'll make progress, Mihiraa.
Thank you, Dr. Stock. I really hope this helps.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor talking to a nurse called Mihiraa. Now read the question.
Mihiraa, have you been following the news about the Nipah virus outbreak?
Yes, it's concerning. The case fatality rate seems quite high.
It's a serious virus with a significant mortality rate. It's primarily zoonotic, transmitted through contact with infected pigs or their secretions. Human-to-human transmission is also possible, especially in healthcare settings.
Are there any specific preventive measures for healthcare workers?
Strict adherence to standard precautions is crucial. Wearing appropriate personal protective equipment, including gloves, gowns, masks, and eye protection, is essential. Proper hand hygiene and disinfection of surfaces are also vital. Mihiraa, it's essential to maintain a high index of suspicion for Nipah virus infections, especially in patients presenting with fever, headache, and respiratory symptoms.
What about treatment options for Nipah virus infection?
Currently, there's no specific antiviral treatment for the Nipah virus. Supportive care, including fluid management and management of complications, is the mainstay of treatment. Early recognition and isolation of infected individuals are crucial to prevent further transmission.
Now look at question 26. You hear a nurse talking to a colleague called Mihiraa. Now read the question.
Mihiraa, how did your shift go today? Anything unusual happens?
It was pretty hectic. We had a few admissions, including a patient with acute chest pain. We managed to stabilize him, but it was a bit stressful.
That sounds like a challenging shift. How did the new staff member handle the workload?
Not too bad. They seem to be adapting well, but they could use a bit more training on certain procedures.
That's good to hear. Remember to offer support and guidance to the new staff. It can be overwhelming at first.
I will. Speaking of new staff, I'm wondering if we'll be getting any additional nurses to cover the increased workload.
Mihiraa, I've heard they're working on it, but it might take a few weeks. In the meantime, we'll need to prioritize our tasks and be efficient with our time.
I'm worried about patient satisfaction if we're stretched too thin.
It's important to communicate with patients and explain any delays. Transparency can help build trust and understanding.
Now look at question 27. You hear a nursing manager, Mihiraa, talking to hospital management. Now read the question.
Good morning, management team. I'd like to discuss a new method for improving patient satisfaction and reducing hospital-acquired infections.
Please go ahead, Mihiraa. We're always open to new ideas.
I've been researching the implementation of a comprehensive hand hygiene program. This involves promoting hand washing among healthcare workers and patients, providing adequate hand hygiene facilities, and conducting regular audits to ensure compliance.
That's a valuable initiative. How do you envision implementing this program?
We can start by conducting a baseline assessment of current hand hygiene practices. This will help us identify areas for improvement. We can then implement educational programs for healthcare workers, including workshops and reminders about hand hygiene techniques. Additionally, we can provide clear signage and hand sanitizer dispensers throughout the hospital.
What are the potential benefits of such a program, Mihiraa?
Improved patient satisfaction, reduced hospital-acquired infections, and enhanced staff morale. By prioritizing hand hygiene, we can create a safer environment for patients and staff.
That sounds promising. We'll discuss this further with the relevant departments and consider allocating resources for the implementation of this program.
Now look at question 28. You hear a nurse called Mihiraa training junior nurses. Now read the question.
Nurses, today we're going to discuss the importance of effective communication in patient care. Clear and concise communication is essential for building trust with patients and ensuring their well-being. It's crucial to listen actively to patients' concerns and respond empathetically.
I agree. But sometimes, patients can be difficult to understand, Mihiraa, especially those with language barriers or cognitive impairments.
That's true. In those situations, it's important to use simple language and avoid medical jargon. Visual aids, such as pictures or diagrams, can also be helpful.
What about patients who are in pain or distressed, Mihiraa? How do we communicate effectively with them?
Patience and understanding are key. Validate their feelings and let them know you're there to help. Sometimes, nonverbal communication, like a gentle touch or a reassuring smile, can be more powerful than words.
I also worry about documenting patient interactions accurately. It can be time-consuming.
Accurate documentation is crucial for continuity of care and legal purposes. It's important to be concise and clear in your notes. Using standardized charting formats can help streamline the process.
What if a patient refuses treatment or medication? How do we handle those situations, Mihiraa?
It's important to respect a patient's autonomy and right to refuse treatment. However, we must also ensure their safety and well-being. Document the patient's refusal and inform the physician for further evaluation.
Now look at question 29. You hear a GP talking to a nurse called Mihiraa. Now read the question.
Mihiraa, have you been following the progress of the new COVID-19 vaccine trial?
Yes, Dr. Frank. It seems promising. The initial results suggest a high efficacy rate.
That's great news. Once it's approved, we need to develop a plan for its distribution and administration in our practice. We should consider factors like patient demographics, risk groups, and availability of resources.
We'll need to ensure we have enough staff and supplies to handle the demand. We should also communicate effectively with our patients about the benefits and risks of the vaccine.
Absolutely, Mihiraa. We should schedule patient education sessions to address any concerns and provide accurate information. It's important to build trust and encourage vaccine uptake.
I've already started compiling a list of patients who are eligible for the vaccine based on their medical history and risk factors.
Excellent. We should also prioritize healthcare workers and individuals in high-risk groups. We need to be prepared to manage any adverse reactions that may occur.
I've reviewed our protocols for managing adverse reactions. We should ensure we have appropriate medications and facilities in place.
Now look at question 30. You hear two nurses talking at the end of the shift. Now read the question.
Mihiraa, how did your shift go today? Anything unusual happens?
It was pretty routine. We had a few admissions, but nothing too serious. Oh, and there was that one patient in room 203. She was quite agitated and refused her medication.
Really? That's unusual. Did you try talking to her and finding out why she's reluctant?
Yes, I did. She mentioned having a bad experience with medication in the past. She's worried about side effects and feels like she's losing control.
That's understandable, Mihiraa. It's important to address her concerns and build trust. Perhaps we could involve the social worker or a psychiatrist to help her manage her anxiety.
That's a good idea. I'll bring it up with the team leader. I also noticed that the supply of 4 fluids is running low. We might need to order more for tomorrow.
Great. I'll take care of that. Remember, we need to be extra vigilant with patient care, especially during busy times. Let's make sure we're not missing anything important.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a dietitian, Dr. Mihiraa, and an interviewer.
Dr. Mihiraa, it's an absolute pleasure to have you here. With over 25 years in geriatric medicine, you've become a renowned expert in the field. Let's start by understanding what a geriatrician does. Could you explain your role and its significance?
Thank you for having me. The role of a geriatrician is both complex and rewarding. At its core, a geriatrician specializes in the healthcare of elderly patients, often dealing with multiple chronic conditions, cognitive decline, and functional impairments. What makes this field unique is the focus on improving quality of life rather than merely extending it. We must look beyond the physical symptoms to understand how aging impacts psychological, social, and emotional well-being. For example, managing a patient with Alzheimer's involves not just addressing memory loss, but also helping the family navigate the emotional strain. It's about seeing the whole picture and tailoring care plans to individual needs, which can vary greatly from patient to patient.
That sounds incredibly intricate, Mihiraa. Reflecting on the early stages of your career, what were some of the most significant experiences that shaped your approach to geriatric care?
The beginning of my career was quite a learning curve. Straight out of medical school, I was eager to make a difference, but quickly realized that geriatric care requires a level of patience and empathy that isn't taught in textbooks. One of my first experiences was with an elderly patient who had multiple comorbidities and was resistant to treatment. It was a humbling experience because it taught me that communication is key in this field. Understanding a patient's fears, values, and what they consider a good quality of life became central to my practice. Early on, I also learned that teamwork is crucial. Geriatric care often involves a multidisciplinary approach, including nurses, physical therapists, social workers, and family members. These early experiences solidified my belief that collaboration and communication are as important as clinical skills in geriatric care.
You mentioned the complexity of treating elderly patients, particularly those with multiple conditions. What were some of the challenges you faced, Mihiraa, and how did you overcome them?
Treating elderly patients is indeed challenging due to the intricate interplay of various medical conditions. One of the biggest challenges I faced was the management of polypharmacy, where a patient is on multiple medications, each with potential side effects and interactions. In the early days, I encountered a patient whose medications were causing more harm than good. It was a pivotal moment for me. I had to critically evaluate every drug, considering whether the benefits outweighed the risks. This experience taught me the importance of deprescribing when necessary and the need for a holistic approach to medication management. Another challenge was addressing the psychological aspects of aging, such as depression and anxiety, which are often overlooked but can significantly impact a patient's health. I had to develop strategies to not only treat these conditions, but also to prevent them by promoting social interaction and mental stimulation among my patients. Over time, I learned that overcoming these challenges requires continuous learning, flexibility, and a deep understanding of each patient's unique circumstances.
That sounds incredibly demanding, both professionally and personally. How did you manage the stress and emotional burden that comes with such a demanding job, Mihiraa?
Managing stress in a field like geriatrics is essential for maintaining both personal well-being and professional effectiveness. Early in my career, I struggled with the emotional weight of losing patients, especially after developing strong bonds with them and their families. It was difficult not to carry that burden home with me. However, I realized that in order to provide the best care, I needed to maintain my own mental health. I began practicing mindfulness and meditation, which helped me stay present and cope with the day-to-day stresses of my job. Additionally, I leaned on my colleagues for support. Sharing experiences with those who understand the unique challenges of our field was incredibly therapeutic. I also made it a point to set boundaries, ensuring I had time for myself and my family, which is crucial for maintaining balance. Over the years, I learned that resilience in this field comes from self-care and a strong support network.
Mihiraa, with such a wealth of experience, what would you say is the most important lesson you've learned throughout your career?
The most important lesson I've learned is the value of empathy and the power of listening. Geriatric patients often feel marginalized, as their concerns can be dismissed or overshadowed by their age. I've found that taking the time to listen to their stories, fears, and desires not only improves their care, but also enhances their overall well-being. Empathy allows you to connect with patients on a deeper level, fostering trust and cooperation, which are essential for effective treatment. I've also learned that medicine is as much an art as it is a science, especially in geriatrics, where textbook solutions often don't apply. Each patient is unique, and the ability to adapt and tailor care to individual needs is something that has only come with experience. It's a lesson that has guided me through the most challenging situations and has been central to my growth as a physician.
Finally, looking back on your 25-year career, how do you feel, Mihiraa, about the journey you've been on?
Reflecting on 25 years in geriatric medicine, I feel a deep sense of fulfillment. The journey has been challenging, yes, but also incredibly rewarding. I've had the privilege of touching so many lives, and each patient has left a lasting impact on me. The field of geriatrics is one that continually evolves, and I feel fortunate to have contributed to its growth over the years. Looking back, I'm proud of the progress I've made and the lessons I've learned. But more than anything, I'm grateful for the relationships I've built with patients, their families, and my colleagues. These relationships have enriched my life in ways I never imagined when I first started. As I look to the future, I'm excited to continue learning and growing, both personally and professionally. The past 25 years have been a remarkable journey, and I look forward to the challenges and opportunities that lie ahead.
Now look at Extract 2. Questions 37 to 42. You hear the President, Dr. Mihiraa, talking about the latest architectural blueprint for the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. I am honored to present the latest architectural blueprint for the Mihiraa Public Hospital, a project that symbolizes our commitment to enhancing healthcare infrastructure. The design represents not just a physical expansion, but a holistic improvement in patient care, operational efficiency, and environmental sustainability. Today, I will walk you through the intricate details of this plan, the meticulous process behind its creation, its anticipated impact, the roadmap for its implementation, future prospects, and the reliability embedded in every facet of this development. The blueprint of Mihiraa Public Hospital is an ambitious expansion designed to accommodate the evolving needs of modern healthcare. This new plan includes a state-of-the-art emergency wing, a specialized oncology center, and a green rooftop garden dedicated to patient rehabilitation. Beyond mere additions, the plan aims to redefine the patient experience through improved navigation, reduced response times, and enhanced privacy. The design also integrates advanced medical technology seamlessly into the infrastructure, ensuring that every corner of the hospital is optimized for both patients and healthcare professionals. This expansion doesn't simply add square footage, it introduces a new paradigm in hospital architecture. The emergency wing, for example, is designed with a radial layout, allowing for quicker access to critical care units from the point of entry. The Oncology Center is equipped with private consultation rooms and infusion areas that offer scenic views, combining clinical efficacy with psychological well-being. The rooftop garden serves a dual purpose. It is a sustainable feature that reduces the hospital's carbon footprint and a therapeutic space where patients can engage in nature-based healing practices. The creation of this plan was a complex endeavor that required the collaboration of multiple disciplines. Architects, healthcare professionals, environmental scientists, and technologists came together to create a design that is both functional and future-proof. The planning process was iterative, with each phase involving detailed simulations, stakeholder feedback, and feasibility studies. A significant focus was on predictive modeling, where data from current hospital operations were analyzed to predict future trends in patient flow and care needs. This data-driven approach enabled us to design spaces that are not only adequate for current requirements, but also flexible enough to adapt to future changes. Moreover, sustainability was a key consideration from the outset. Environmental impact assessments were conducted to minimize the hospital's ecological footprint, leading to the incorporation of energy-efficient systems and materials that reduce waste and conserve resources. Additionally, we integrated cutting-edge technology into the design phase itself, using building information modeling, BM, to simulate real-world scenarios. This allowed us to anticipate potential challenges in the construction and operation phases and to refine the design accordingly. The implementation of this architectural plan is expected to significantly impact the quality of healthcare delivery at Mihiraa Public Hospital. By optimizing space usage and improving the workflow within the hospital, the plan aims to reduce patient waiting times and enhance the efficiency of medical procedures. The new facilities will enable the hospital to offer specialized care that was previously unavailable, thus reducing the need for patients to seek treatment elsewhere. Furthermore, the design emphasizes patient-centered care, with spaces specifically tailored to promote healing and well-being. The Oncology Center's private rooms, for instance, allow for personalized treatment regimens in a tranquil environment. The inclusion of the rooftop garden is another transformative feature, offering not just a space for relaxation, but also a venue for therapeutic activities such as yoga and meditation. On an operational level, the new design will streamline hospital logistics, reducing bottlenecks and enhancing the overall patient experience. The radial design of the emergency wing, for instance, is expected to cut down on critical care response times by up to 20%, a potentially life-saving improvement. Turning this ambitious plan into reality will require a carefully phased approach. The implementation strategy has been designed to ensure that the hospital remains fully operational during the construction process. The project will be executed in stages, starting with the construction of the new emergency wing, followed by the Oncology Center, and finally the rooftop garden. A key aspect of the implementation strategy is the use of modular construction techniques. This approach allows for sections of the hospital to be built off-site and then assembled on-site, significantly reducing disruption to hospital operations. Additionally, we have planned for the use of advanced construction materials that can withstand the rigors of a hospital environment while also being environmentally friendly. Communication with hospital staff and patients will be critical throughout the construction process. Regular updates will be provided to ensure that everyone is aware of the progress and any temporary changes to hospital services. The design of Mihiraa Public Hospital is not just about addressing current needs, but also about laying the groundwork for future expansions. The modular nature of the construction allows for easy addition of new wings or facilities as the need arises. Moreover, the infrastructure has been designed to accommodate future technological advancements. The hospital's digital infrastructure is built on a scalable platform, ensuring that it can easily integrate new medical technologies, such as telemedicine suites or robotic surgery units, as they become available. In terms of sustainability, the hospital is designed to evolve with changing environmental standards. The building's energy systems are modular, allowing for upgrades to more efficient systems as they are developed. This forward-thinking approach ensures that Mihiraa Public Hospital will continue to be a leader in healthcare infrastructure for decades to come. The reliability of the new hospital infrastructure is a core focus of the design. Every aspect of the plan has been scrutinized for durability and resilience. The choice of materials, for instance, was guided by both their environmental impact and their longevity in a hospital setting. The use of high-performance concrete and antimicrobial surfaces ensures that the building will withstand the test of time while maintaining the highest standards of hygiene. In addition, the building systems have been designed with redundancy to ensure that critical services are always available. For example, the hospital will have multiple power sources, including a backup generator and solar panels, to ensure uninterrupted operation during emergencies. The reliability of the hospital's operations is further enhanced by the design's focus on ease of maintenance. Access points for maintenance staff have been strategically placed to minimize disruption, and the use of modular components means that repairs and upgrades can be carried out quickly and efficiently. This attention to detail ensures that Mihiraa Public Hospital will continue to provide top-tier healthcare services without interruption for many years to come.
That is the end of your OET listening test. Now check the answers.